Hi, we're back. We have our patient sedated. We were just going to kind of show you what we do before we actually begin the dental, the things that we do for monitoring and for the patient's comfort. We do provide them with a warm towel that we get out of our towel warmer, which is fantastic.
Who wants me?
We've also got our EKG hooked up. We've got the sound turned off of it right now, but we have each one of these we have labeled, goes to a certain specific area of the body. We hook them up, put a little bit of alcohol on it for good contact, and that helps us as a monitoring device down here. We also like to give IV fluids during our surgery, just as a precaution. We put a new needle on it. We've got our bag, and we go ahead and hook it up into our IV catheter that every one of our dentals gets. We like to have IV access for all of our surgery patients. And we get this going and dripping. And for him, we'll do about 50 to 100 just as a maintenance. We do also trim nails on all of our dentals, generally clean anal glands, clean ears. If they need their ears plucked, anything like that, now's the time to do it because they're sedated. So we do that kind of as a courtesy for all of our dentals. Now, we've got our patient's face covered, which we normally wouldn't. Sometimes we would to protect them from the bacteria and stuff, but we're trying to be a little discreet with our patient here. Our endotracheal tube has been placed. This right here, we use a syringe to blow just a little bit of air into it. Now what this does, this is an example of what's in here. Okay, we've got our endotracheal tube. What this does is once you've got it placed, you push a little bit of air in there and it blows this little cuff up. And what it does is not only does it provide protection, say this is the trachea, it provides protection from water going around it into the lungs, but it also provides so that it can't slide and move and shift, which could cause it to go down into one bronchi, cause it to come out. It just kind of keeps it in place and still where we want it to be. We also have to be careful not to blow this up too tight because you can cause damage to the trachea. So we try to monitor it according to whether or not we can hear the airflow around the tube. Right when you stop hearing the airflow is where we want to stop blowing up this endotracheal tube. So we've got his in place. We put just about a cc or two inside because this one was actually a pretty good fit with the endotracheal tube. And I think we are now ready to actually begin our dental cleaning. We like to wear gloves and face mask to protect ourselves because there's lots of bacteria that can be flying around. And I think, now this is kind of a before picture of his teeth, okay? Got a lot of this hard calculus. He's got a loose tooth right here, which will probably just, that bad boy will probably fall right out. And then we're going to remove all of this tartar right here by scaling. We're going to check this tooth out because it looks like it's got a lot of root exposure, but sometimes it can be hard to tell until we actually get the calculus off of there what the actual tooth looks like. He's got a lot of hair built up around there. So if you want to take a look at that. And then we're going to start scaling a little bit of stuff off. There we go. See, we just sit it on the side. You don't want to ever put it at a 90-degree angle because you could damage the tooth. So just kind of do it on the side. And it's kind of like coloring the tooth. You're just coloring away that tartar. Okay, now this tooth in particular is probably going to come out of there. But just for the sake of showing you guys a good example here. Stinks too. You just kind of color it away. And it uses water because this tip can get really hot and the water kind of helps keep it cool so that we don't do any damage to the tooth. And what we'll do is we will get these teeth all scaled off, and then we'll come back and we'll show you kind of the after picture, so you can see after we get everything scaled what it looks like.